Kramer here, registered physiotherapist. Today I'd like to talk to you about a shoulder condition referred to as a tear of the labrum. So essentially what a labral tear is, you can think of the shoulder joint as essentially a ball and socket joint, right? So you've got the head of your humerus, it essentially inserts and attaches onto the shoulder blade through an area called the glenoid fossa. Now, on the outer surface, essentially, of this glenoid fossa, you have this connective tissue that basically supports, sort of like a ring at the outer edges of this, that support the stability of the head of your humerus, again, in through that shoulder blade region. Now, what can happen in a lot of cases is due to some sort of repetitive strain of some type, or in some cases there's some sort of trauma involved, or a dislocation as a result of again, a traumatic movement, or a fall on an outstretched arm, or being hit in a certain position. The outer ring that we talked about, that again helps with regards to stability, it gets torn. And then as a result of that, the patient will tend to feel as though the shoulder just doesn't feel very secure. It feels as though it's going to separate or dislocate, and there's constantly this feeling, this uneasy feeling that patients have as a result of this. Now, in terms of the shoulder joint in particular, it's not a very deep ball and socket joint. And so what I mean by that is, if we compare it to, for example, the hip joint, well, the head of the femur, it inserts much deeper, right, within the pelvis. So there's a lot more specific, let's call it bone stability, as opposed to the shoulder, which is much not quite as deep. And so there's a lot more reliance on the musculature around, so the rotator cuff muscles, for example, around the shoulder, to maintain this stability. So again, what will happen in these cases is, if the labrum is torn, there'll be this constant unease, and there'll be very specific positions that patients just won't like to go into, and that'll feel, again, this sort of unease. So in these cases, right, there's a couple of different options. So for some patients, they're able to recover from this just through a rehab conservative treatment standpoint. So really what this entails is building up the strength within these different supportive structures, these different rotator cuff muscles, in a very dynamic exercise program, right? So basically we're getting these muscles strong in vulnerable positions for the patient. The other option, and it really depends on lifestyle in these cases, or what sort of activities perhaps that the patient's involved in, the other option is to actually get some surgery done. So essentially with that, they repair the labrum, and then there's a period of time in which unfortunately the patient will be immobile, typically will be in a sling of some type, and then there's a rehab process that then involves physiotherapy, in which again there's a regaining of mobility, of strength, and then making the exercises and the stability strong in a very functional type of manner. So again, it really varies in terms of patients, the degree of the tear, what sort of activities they want to get back into, whether surgery is a route that needs to be done, or if the patient can essentially compensate, right, for this lack of internal stability within the head of the humerus by, again, getting stronger in terms of these different supportive and again rotator strengthening, etc. Thanks again for watching. Please make sure that this exercise is appropriate for you by speaking with a physiotherapist, and please subscribe below. Thanks again. Have a great day.